Imagine this. You're sitting in your living room, flipping through an old photo album. Suddenly, you remember a loved one who passed away suddenly, without warning, or so it seemed. What if I told you that there might have been subtle signs of a stroke that were missed? Signs that could have been spotted 30 days before it was too late. Stroke is the 5th leading cause of death worldwide, but here's the catch. Not all strokes come with dramatic symptoms like slurred speech or one-sided paralysis. In fact, some of the signs are so subtle that they can easily be mistaken for something less serious. Let's explore the top 10 stroke signs you might miss. Historically, strokes were known as apoplexy, a term originating from the Greek word apoplexia, meaning a striking down. This term was used as early as 400 BC by the father of medicine, Hippocrates. Back then, apoplexy described any sudden event where a person fell unconscious and couldn't be awakened, often leading to death. The understanding of strokes was rudimentary, with ancient physicians associating the condition with humoral imbalances or divine punishment rather than the brain's intricate functions. In the centuries that followed, little progress was made in understanding the brain's role in apoplexy. For much of human history, the brain was a mystery. The prevailing belief was that the heart or other organs played a more central role in health and disease. It wasn't until the 17th century, with the work of anatomists like Thomas Willis, that the connection between the brain and the body's nervous system began to be explored in depth. Willis, often referred to as the father of neuroscience, was the first to use the term neurology and significantly advanced our understanding of the brain and its blood supply. A pivotal moment in stroke history occurred in 1628 when English physician William Harvey published his groundbreaking work on blood circulation. This discovery set the stage for understanding how disruptions in blood flow to the brain could lead to what we now call a stroke. However, even with these advances, treatments remained primitive. Patients who survived a stroke were often left to languish without effective medical intervention, relying on natural recovery or rudimentary care. It wasn't until the late 19th and early 20th centuries that medical science began to make more significant strides. The term cerebrovascular accident, CVA, was introduced, reflecting a better understanding of the vascular causes of stroke. The development of modern neurology in the 20th century, alongside advances in imaging technologies like CT and MRI scans, revolutionized our ability to diagnose and treat strokes. The introduction of thrombolytic therapy in the 1990s, which could dissolve clots causing ischemic strokes, marked another leap forward, offering patients a chance for recovery that was previously unimaginable. Despite these advances, the early signs of a stroke can still be elusive. Often, they are so subtle that they are mistaken for other less serious conditions, leading to delays in treatment that can be devastating. By recognizing these early symptoms, some of which were noted by ancient physicians under the guise of apoplexy, we can act more swiftly and prevent the severe consequences that have plagued stroke victims throughout history. Consider the story of John, a 58-year-old father of 2. He was active, healthy, and full of life. But for weeks before his stroke, John experienced unusual fatigue, occasional dizziness, and minor memory lapses. He brushed them off, thinking it was just stress or aging. Then one evening, as he sat down to watch TV with his family, it hit him, a massive stroke. John survived, but he was left with significant impairments. What if he had known that those subtle symptoms were warning signs? So what are these signs? Let's break them down. 1. Sudden fatigue. Feeling unusually tired or drained for no clear reason can be a precursor to a stroke. It's your body's way of signaling that something's wrong. Dizziness or loss of balance. If you feel like the room is spinning or you stumble more than usual, don't just brush it off as clumsiness. 3. Unexpected memory lapses. Struggling to remember simple things can be a red flag, especially if it's out of the ordinary for you. Difficulty. Understanding speech. You may find yourself unable to follow conversations or struggling to find the right words. This is not just getting old. Sudden severe headache. We all get headaches, but a sudden intense headache with no known cause could be the precursor to a stroke, particularly in the posterior part of the brain. Changes in vision. Experiencing double vision or partial vision loss, even temporarily, is a warning sign that should never be ignored. Nausea or vomiting. Without explanation, feeling sick to your stomach without a clear reason can sometimes be related to a stroke, especially if accompanied by other symptoms. Sudden confusion. If you find yourself suddenly confused, unable to think clearly, or having trouble focusing, take it seriously. 9. Numbness or weakness in limbs. While this is a more well-known symptom, it can sometimes be so subtle that it's dismissed, especially if it's fleeting. 10. Unexplained jerky movements. You might experience sudden involuntary jerks or twitches, which can indicate a problem in the brain's electrical activity. Time is of the essence when it comes to strokes. The American Stroke Association emphasizes the F.A.S.T approach: face drooping, arm weakness, speech difficulty, and time to call 911. But beyond F.A.S.T, these other signs can occur even earlier, sometimes days or weeks before the actual event. Research shows that about 80% of strokes can be prevented with the right awareness and timely action. Recognizing these early signs and seeking medical help immediately can significantly reduce the risk of severe outcomes. Imagine the difference it could make, spotting these signs early, acting fast, and keeping your loved ones safe. Knowledge is power, and now it's in your hands. Don't wait until it's too late.